Hello, good morning, and Happy New Year. Thank you so much for being with us here today. My name is Jacob Borkover from the webinar team at PCI HIPAA, and really want to just thank you all for being here today. We've got a great presentation in store for you with Mr. Terry McDonald. It's going to be a really great hour and a half. So before we jump into it, just a few quick housekeeping notes here. This is a 1.5 CE credit course. We are PACE accredited through AGD to provide CE. You will be receiving your CE credits sometime within the next 2 weeks, so be on the lookout in your inbox for those CE credits heading your way. We are going to have 3 polling questions during this webinar. That's how we make sure that you're engaged and paying attention. So please fill those out. It is important and it is part of the CE requirement. So make sure you're doing that. If you're joining us from mobile today, it is a better experience on desktop. You may not be able to do some of the polling questions. It may be a little bit difficult to hear. So if you can get to a computer, please do so. At the end of the webinar today, you'll be prompted to take a brief survey. That's really important so we know how we're doing. And we will be selecting 3 lucky survey respondents to win an Amazon gift card. So just a little bit extra incentive to provide that feedback. And also, there's going to be a few resources throughout this presentation today, including a HIPAA risk assessment. All of the links to everything we were talking about will be placed in the chat. So if you can't find it, just look in the chat box and you'll find the links to everything there. And if you have any questions throughout, feel free to ask a question through the question tab. So exhale, that's my long speech. Without further ado, really excited to introduce Terry McDonald, Director of Compliance Solutions for PCI HIPAA. When it comes to HIPAA, OSHA, and PCI compliance, there really aren't too many people that are more qualified to do this. Terry's truly an expert and is going to give a great presentation. So with that, Terry, the floor is yours.
Thank you, Jacob. Thank you, Jacob. And good morning, tip of the good afternoon for many people all over the country. I see we have almost 500 people here, so good morning. Obviously, as you see here, my name is Terry McDonald. I'm the Director of Compliance Solutions here at PCI HIPAA and Rectangle Health, and it is an honor to get a chance to be able to do this with you. I think we've all had some exposure to HIPAA in some shape or form, and I think one thing we could probably all agree on, it's far from riveting and exciting. You know, it's kind of a necessary, I don't call it necessary evil, it's a necessary good, but it doesn't mean that it's fun, kind of like exercising. But I'm excited to get in here. As you can probably see on the back, I put HIPAA made easy. I want to make HIPAA interesting. I don't want you to fall asleep on this CE. I want you to take away and learn some things that you're going to really be able to take to your practice and make actionable and make changes, really create that culture of compliance. So without further ado, I am setting out to give you the best HIPAA education you've ever gotten. Hopefully, I don't know if that's a high bar or not, but I'm hoping to make this the most entertaining, smooth, informative HIPAA training that you've ever had. So it's my honor to be able to get to do this for you. So let's get going. We have a lot to cover in a short hour and a half. So of course, we're going to have a little bit of housekeeping. So everyone wants to know this is what we're here for. It's not for me. It's, hey, when do I get my CE? Hey, within the next 2 weeks, Jacob and his amazing webinar team, they're going to get an email over to you. I'll have your CE in it within the next 2 weeks. And obviously be conscious, that's going to go to the email that you use to register here. So you may have logged in with a different one or who knows, but it's going to go to the one that you sent over, you originally registered with. So if you have any issues, also email us back. We'll take great care of you. Jacob and his team are incredible. So who are we? Well, particularly, first of all, we're Rectangle Health. Our mother company is Rectangle Health, and one of our divisions is PCI HIPAA. That's our compliance arm. And our compliance arm, really our main product is Office Safe. But the point being, though, is this is what we do. There is not a company out there that's educated more people on compliance. We have over 5,000 practices we actively help or work with every single day, hundreds of societies. I mean, these are just a couple of the logos here. I mean, bottom line, this is what we do, and other major professional organizations trust and lean on us as well. So thank you for that trust. I think you're going to be able to see here today exactly how we've earned that trust, and it's really through education. We have an old saying here, and it's that HIPAA protects patients and their PHI. OSHA protects you, the employees. But we consider ourselves here at PCI HIPAA and Rectangle Health, we are here to protect you, the doctors, the business owners, the office managers, the frontline people. We're here to protect you. And I think you're going to see that we're really equipping you to do a great job. So let's get going on what our agenda is here today. We're going to talk about the risk to that PHI, to your health information. We'll talk about some of the news of what's going on in HIPAA. We're going to go over the basics of the safeguards. And I'm definitely going to put you through a HIPAA risk assessment. You're going to find out about that. You need to do one this year anyway. It's a great way to start an education session, is to show you what you don't know, to make sure that you're really aware of what you need to dive in on. We're going to talk about ransomware and all the other crazy cybersecurity threats that we're facing every day. We're going to sprinkle in just a tad of OSHA and COVID-19. Unfortunately, it hasn't gone away. And we'll close out with a couple quick tips to protect your practice. And we have a bunch of offers and additional CE we can give away, and we'll let you know about that as soon as we wrap up the actual CE portion. So a couple of things you see on the left: no notes. You don't have to, take notes or things that maybe you want to follow up on, but just know we will send you a copy of this presentation after we're complete. And Jacob is monitoring the chat log. So if you have incredible questions or even stupid questions, I say that because people think they're stupid, ask it. You're not the only one thinking it, and the discussion really creates a great learning environment for everyone. So if you have questions, shoot in the chat box and Jacob will make sure I see it and point it out to me. Jacob, just so you know, I do have my Teams open here, so I got a window dedicated to you. So tell me what you need to let me know via Teams, and we'll be in great shape. So because obviously this is recorded, so this is being recorded for training purposes. You won't be recorded, I will be. And we are talking law, so I need everyone to read a quick disclaimer for me real fast. Let me know when you get done. Perfect. I'm assuming you guys all got that. Oh, this is a joke anyway. The real disclaimer is that there is no one-size-fits-all compliance solution. People have a feeling that HIPAA is, hey, I just need to check the box. And actually, it's not a once-a-year check the box thing. It's actually quite complicated, or it can be. Let me give you a quick example here. This here is the simplified version of the HIPAA law that we're all here to discuss today. 115 pages, 3 columns each page full of legalese. If you're having trouble sleeping at night, I highly recommend you ask us for this link. It'll put you to sleep real fast. So I also know through experience that of the 500 people here, probably 0 people have ever read this 115-page document besides me. And it took me a while, and I didn't learn a ton. The art of this is, what do I need? What's the most important information of all this? And that's what I want to really get out there to you all today is, you're not going to read this law. Let me tell you what it's saying and what you need to take away from it. So let's keep it simple, high level. What is HIPAA? A simple law created in 1996. It actually covered a lot of things about health insurance and everything beyond just protecting people's information. But for the purpose of what you and I care about, and what HIPAA, the government, when they're managing you, what they care about, it's all about protecting information. What are the tools and processes we're doing by that? It is actually obviously ran by the Department of Health and Human Services Office of Civil Rights. Most people have probably never heard of the Office of Civil Rights. And then the law itself was pretty old. In 1996, probably half of you, maybe tops, less, were practicing in 1996. And you probably remember what practices were like. You had the huge, big computer monitors. You had fax machines over here. It wasn't all about the internet, and you weren't worried about cyber crime back in 1996. So in 2013, it was really modernized with the omnibus rule. And it added a little tiny E in front of that PHI, and that's electronic protected health information. All of you know that acronym, protected health information. It is the whole point of what HIPAA is about. It's all the information we're trying to keep safe that could fall into the wrong hands. And it's a risky business. There's areas that you're going to want to consider when it comes to that. First is obviously non-compliance. We don't want to be non-compliant, and that will lead us to greater risk of having a data breach. And when you have these two extreme factors of non-compliance, and then you deal with a data breach, you will be on the hook for financial and reputational damage. We're going to talk about all the fines that come with not being compliant, and I'm going to show you a number of articles that are forever on the internet, that are tied to a practice and their reputation forever, just for the sake that they got fined and now it's on the internet. I'm going to use them as examples during this call. So why is that a thing? Well, it's super important that we're trying to protect ourselves, because as Consumer Report says, your most personal information, hospitals, doctors, insurance companies, us, we are increasingly a target for hackers. And it's not hard to try to figure out why. If I wanted to steal your identity, everything I need is in your medical file. I got your name, your address, your next of kin. Sometimes I got your credit card numbers, you name it. Your file is worth so much to me. And that PHI comes in a lot of shapes and forms. Here's a whole list of all these things that are considered PHI that we are responsible for protecting. So things that help us fall into those traps. Here's a quick example of, for example, a ransomware screen. So if you don't know what ransomware is, we're going to talk about it several times here today. So I want to get it out of the way early because it's a great example and it's happening every day, whether you know it or not. I'm going to put it on your radar. Ransomware is just like it sounds. It's software, it's computer that it's going to take over your computer and basically freeze it. You can't use your computer. You can't use any of the computers in your practice, and they're frozen. And they want you to pay them a ransom, typically in like Bitcoin, so it can't be traced, in order to free up your computers. These bad actors, I don't know if they're in Russia or Iran or where they are, they don't want to steal your information. They're not identity thieves, they're ransomware artists. They want their ransom, and then that way they can go on and do it to somebody else. Their threat to you is, if you don't pay us, we'll release this information out to the public so people that are in the business of identity theft have no trouble doing what they do best and taking your client's information. So we have to protect ourselves for this. And this happens all the time because these records go for $1,000, up to $1,000 on the internet. So it's $1,000 per record, and think about for a second how many records you have in your practice. Most people have anywhere from 500 to 50,000 based on the number of patients that they've seen. Times that by 1,000. So we're talking millions and millions of dollars. The most valuable thing in your practice, besides the lives, obviously, of everyone there, is this digital information. Cybercrime is out there. It's happening every single day. Let me give you another example of what's out there. Stolen credit card numbers. We can go to websites literally and shop like we're going to Amazon. I want to steal some credit card numbers. I need some PIN codes and things like that. I can go on the web and just start shopping. Let's see here. What do we got here? We got a clean PayPal. We got a US credit card 50 pack. We got some Venmo. Let's see. We got some Canadian credit cards. You know, it's insane that they're on here just selling this stuff like this. It's available. It's out there on the internet. It's out there for sale on the dark web as well. We have to understand that this is a real whole business and you are the product. People are out there selling it. Let me show you something that'll blow your mind. This website, many of you probably have never been to. Maybe you've talked to people on my team here before, so we've taught you. This is the Office of Civil Rights, Department of Health and Human Services breach portal. These are all the practices around the US that have reported a cyber breach, a HIPAA issue. Let me just scroll down here real fast to the bottom. I'll point out we have 100 practices on here, and this only goes back to the end of October. So there's been over 100 breaches reported in less than 100 days. This is literally happening more than once a day. And look here, look at the states. Every single state this is happening. And as you see here, hacking, IT, network server, hacking, email, hacking, EMR program, hacking. 90% of what we're dealing with these days are cyber issues. It could be you, a healthcare provider. It could be somebody you're working with, a business associate. Heck, even health plans are dealing with breaches. And mind you, this is just medical businesses. This is affecting every type of business out there. I like to use the example here. I'm in Las Vegas. Come visit me sometime. I'm in Las Vegas. We have the second largest school district in America. And I don't actually have any kids, but it was a big deal out here because here in Nevada, the school district dealt with a ransomware incident. And many times public organizations and things, they don't have a ransom policy. They're not going to pay ransom. So they told everybody, hey, your information was breached. Every single parent, student and teacher had their name and social security numbers released. The whole city had this happen to them. This is happening all the time, my friends. I'm trying to not scare you, but build awareness. And this is to prepare you from the real world that we're living in now. It's not really about if it can happen to us. It's really a matter of when. And the numbers actually show that. So we have to do some things. We have to change our thinking to make sure that we're prepared to handle it. So the question I'm asking you is, how do you HIPAA? Because a lot of you, and there's nothing wrong with it, I'm going to help you do better here today. But a lot of you are operating here on this left side, the casual and vulnerable side. You have a loose training schedule. We don't have someone designated to really kind of run point on compliance, really. We have a binder, we don't, maybe it's not customized, it's collecting dust somewhere. We don't really have an emergency plan. That's a HIPAA emergency plan, not when there's a fire. And it's your calling card is, we do our best. We use common sense. That's not going to get the job done, to be honest with you. As a business owner, we have to protect ourselves. We have to do things the formal way. It doesn't really take more work, and it's going to save you a lot more money. We have to have a formal training plan. We have to have signed employee acknowledgement saying they've done that training. There is going to be someone designated and trained to be the certified compliance officer within our practice. Doctors, I'm going to make it real easy for you to designate that to someone. Your policies and procedures need to be written out. You need to have a formal emergency plan with an incident response team. You probably may or may not know what that is. I'll teach you. And usually, I mean, you can try to do this on your own, but a lot of people turn to an expert to really help them because, like I said, 155-page law is not easy to navigate yourself, and it changes all the time. So if we don't do this, if we want to continue to operate on the casual and vulnerable, we will face consequences and repercussions. And the question is it going to be a $100 fine or is it going to be a $50,000 fine? Is it $100 or is it $1.5 million? So one of the key things I want to point out here is this fourth tier here. There we go. And the key word here is willful neglect. This means we knew we weren't running a completely compliant practice, and yet we did nothing about it within 30 days. I'm going to open up your mind and show you some things today. All of you are going to find one or two things at least that you could probably do better. My advice is don't wait. You have 30 days before it can really cost you. And a lot of these things can really, I mean, small fixes can go a long way. I'll save you all the painful stories I've seen and witnessed personally running this. So let's avoid these fines. Let's just start doing it the right way. I know all of you are here to do that. So let's get moving on. So what does HIPAA really require of us? Well, there's really kind of three basic categories to HIPAA. One is the administrative safeguards, right? What are the basic policies and procedures that we've documented that we're doing actively to protect PHI? Then you have your technical safeguards. And let's just think of it as, this is the computer. If someone was trying to get to my information via computer, what are all the things I need to do to stop them from attacking my PHI via their computer, via the internet? And then physical safeguards, let's say someone's trying to physically come in and steal my stuff. What are all the things I'm doing to stop that from physically happening? So this is a CE, so we do have polling questions. So be prepared to answer this polling question right now. For everyone out there, which of these is not one of the three key HIPAA safeguards? Is it A, physical safeguards, B, office safeguards, C, technical safeguards, and D, administrative safeguards? Gonna give you a second to do the polling. As you probably see, your poll is open. It's giving you a big red arrow to tell you to, it may give you an arrow to tell you to answer the poll. Everyone's got that.
All right. All right,
Jacob.
Terry, looks like we've got our results here. 58% said office safeguards, 24% said physical safeguards.
Okay. Though at that 58% of people, I'm very, very proud of you. That is correct. That is not one of them. So if you were close saying physical safeguards, you were probably thinking of office safeguards sticking up your door, but no, it's B, office safeguards. That's kind of the physical safeguards a little bit there. So, all right, thank you, Jacob. All right, let's talk really fast about the HIPAA risk assessment. This is one of the most important parts of HIPAA, and it's why I really kind of start here now that I've really set the table. HIPAA, according to the law, so down here in this section here, the risk analysis should be an ongoing process. This is taken directly from the big, huge law that I took, that I showed you. HIPAA requires you basically every year to go in and do an assessment and assess how well you are doing in actually adhering to HIPAA law. HIPAA law doesn't say do this every single year. It describes it as an ongoing process. But I'll tell you something else that'll surprise you. It also doesn't tell you to do training every year. It tells you to do it an ongoing and regular process. So best practices is just to obviously do it every single year. So that is the way I teach our practices is every single year you need to do a HIPAA risk assessment. It's really for your own good. Okay, it's going to be a series of multiple choice questions, or our version of it will be, that you're going to answer. And at the end of it, it's going to give you a score and tell you what your deficiencies are. It's not enough to just do a risk assessment. Your job is to do a risk assessment and use it to fix your gaps. As the law changes every year, as your personnel changes every year, it's important that this is happening so you can stay on top of it. So you have to do this. It's the beginning of the year, so I'm going to help you get one done now. And the reason why we're going to do one here together is so that way, as the rest of this hour and 10 minutes that I'm talking, you really can say, I didn't know that. This is something that's important to me. I want to learn this stuff. And I want you to see what you don't know. And I'll give you all an opportunity on how we're going to review it as individually after the CE is over. So what we're going to do is, Jacob, if you could share the link. Jacob is going to share a link here in the chat box, the same link you're seeing here on your screen. Now, here's the kicker. Here's the most important notes. I only need one person from each practice to do this. Ideally, it is the doctor first, or whoever is in charge of handling compliance for the practice. One person from each practice. If you are the only person from your practice on here and you're not in charge of HIPAA, don't worry about it. I still want you to do this. It's going to be a great gauge of what you know about your own practice's risk. So one person from every practice, click this link. What it's going to do is it's going to take you to this page. Put your first name, your last name, put your doctor's name in there if that's not you. Put your practice's name in there. The best phone number for us to reach you, or your practice's number. For your email, here is a tricky part I want to explain to everyone. If your email is already in our system, your main practice's email, or even just yours, if we've done this with you before, we may have done it with your practice 10 years ago and you don't even know it. It may say email address already taken. If that's the case, just throw a couple numbers in there or something. You see how I did a 444? Just throw a couple numbers in there. It's not going to matter. Okay, when this is all said and done, we're going to find you. We have your phone number. We have your registration information. We'll still be able to get you a copy of this report. But if you're having trouble registering because it says email address is taken, add a few numbers there at the end. We'll know that most likely that's what we need to remove. And then as far as code optional, you can just put CE and today's date. So that way we can track these to the right group. I'm going to give you 30 more seconds to get this completed. And then we're going to click continue. And I'm going to walk you through these questions real fast. All right, I'm gonna get going. After you click continue, it will take you to the actual risk assessment itself. All of us are doing it at once, so it's moving just a smidgen slow. We have 560 people doing it at once, but it's gonna work, I promise. All right, there's mine's loading, so I'm assuming several of yours have loaded. So let's just go start going through these one by one. I'm not gonna overly explain the answers. I just want to give you enough information for you to answer the question. If you don't know it, that's okay. For example, number one, does your practice create and implement HIPAA policies and procedures for assessing and managing risk of EPHI? Do you have HIPAA policies and procedures created? Yes, no, or uncertain. Number two, when was the last time you updated those policies and procedures? Was it in the last 12 months? Was it over 12 months ago? Or do you not even have a set of HIPAA policies and procedures? Do you not have a HIPAA binder sitting there in your office? It's okay. I want to point out, this isn't pass or fail. You're not going to jail over this. You want to be as honest as possible so we can give you the best help as possible. Every gap you show us, now we can teach you how to close it. Next one. Number three, does your practice maintain a formal program to mitigate threats and risks that are found within the risk analysis? And have you documented what you've done in your binder? So let me simplify this. You have to have a formal program to identify threats and risks, like this risk assessment. This is what we're doing now. And as I told you, it's not enough to do it. You have to fix whatever you find and document in your binder what you did to fix it. So are you doing all of that? That's hard to do, but if you are, click yes, if no, or uncertain, if you're not sure. Number four, does your practice create and maintain a workstation use, acceptable use, and sanction policies for its workforce members? These are three different policies that would go in your binder. These are three that you may have a binder, it may be physical, it may be digital. Those are very specific policies, and if you don't know what they are, click uncertain. Number five, does your practice have policies and procedures to review information system activity? What this means is, do you have a system to where you can monitor someone's computer and know what they're doing on that computer? I know what all of my employees are doing. I know what websites they're going to. So if they go somewhere and create a breach in my office, I'm gonna know who did it and how they got there. Do you have a policy like that or a system? Maybe you need to ask your IT department. Number six, have you designated a security officer to be in charge of your HIPAA compliance at your practice? And does that security officer understand what it means to be that security officer for your practice? Do you have a designated person in charge of compliance, and do they understand their job and responsibilities? Number seven, does your practice maintain records to identify each employee's access to practice facilities, information, electronic devices, and EPHI? Similar to like I just said with being able to track somebody on their computer, do you know, does someone have a key card to get in the building or a private server room? Are you able to track that? Yes, no, ask IT. Number eight, has your practice identified all business associates that you're working with? And do you have the required business associate agreements on file with those parties? So let me give you an example that's easy for everyone to understand. Everyone has some sort of practice management software that they're typing patient info into. They are a business associate. Do you have an agreement with them signed that they're going to protect PHI? They probably had you sign one. Did you have them sign one back to you? Yes, no, ask IT. Number nine, if you did by chance have that business associate agreement, does that agreement have an indemnification clause in it? And that is going to protect you financially from a data breach that your business associate may have. So basically, you're going to have a business associate contract agreement, and there's going to be a paragraph in there that says indemnification clause. Most people don't know that, so no shame in clicking not sure. Number 10, do you screen employees prior to giving them access to your facility? A lot of people do background checks. Sometimes I have clients, you know, they're living in a small town. Everyone knows everyone. They don't quite do that. Everyone has a different process. Do you have it? Yes, no, uncertain. When was the last time you've done HIPAA training for your team members? That's this. I'm summarizing the question, make it easy for you. Number 11, when was the last time have you done HIPAA training with your team? Within the last 12 months, over 12 months ago, or we don't do training because we just use common sense. Nothing wrong with that, just as long as the government doesn't find out. Number 12, how was that security and awareness training conducted? Was it put on by a fast-talking, over-caffeinated, ball-headed guy? Did the HIPAA advisor come to your office? You do it online? Did you purchase something? Number 13, does your practice have an incident response policies and procedures that assign specific roles and responsibilities in case of an emergency or an incident? So let me this points out, let me define policies and procedures. A policy is a written policy that's in a binder. It's written down somewhere. It's not like, hey, you verbally told someone. It's like, do you have a physical written down policy? And does that policy define who's going to handle stuff in the event of a HIPAA emergency? Yes, no. Ask IT. Number 14, does that practice's incident response system prioritize recovery actions such as key systems and how you access information? So let me simplify it. If you do have an incident response plan, somewhere in there it should say, hey, the first thing we do is make sure the computers are on, or that they're still password protected. Or the second thing we're going to do is, do you have a prioritization list? Number 15, does your practice have formal policies and procedures when you no longer work with the business associate agreement? You have these business, if I change practice management softwares, do I have a process on how I terminate that agreement? Number 16, does your practice assure that its policies and procedures and other documentation are retained for at least 6 years from the date that it was created or last in effect? Bottom line is, I want you to look at this HIPAA binder as anything and everything you do or have done when it comes to HIPAA is documented in here for at least the last 6 years. Basically, I can walk into your office for an audit and I say, look, don't say anything, hand me your binder, and I should know everything you've done for the last 6 years when it comes to HIPAA. That's not easy to do. Yes, no, or uncertain. Number 17, does your practice maintain documentation identifying which HIPAA safeguards have been implemented and a history that these employees have done this training? They've signed a form saying they've done it. Okay, when you do training, that's great. But every single employee has to sign a piece of paper saying, I've done my training and I read the policies and procedures and I understand them. If you don't have that employee acknowledgement written down in that binder, did it really exist? The government would say no. They're going to fine you. Number 18, does your practice understand the requirements of the breach notification rule in case you do have a data breach? So I'm going to go over the breach notification rule. It's the part of the law that says this is what you're required to do if you deal with a breach. Do you really understand that? I mean, most of us have never dealt with a breach. So do you really know what to do when you have one? Most people will probably click uncertain. Number 19, does your practice have policies and procedures to assign a unique ID to each user? Basically, do I have an employee number? Can you track me when I use stuff and when I do stuff? Do your employees have an employee number, a way to track them? And is that in your policies and procedures? I don't know. Number 20, how are you currently backing up your PHI? Do you have a physical data backup? Are you backing it offsite in the cloud? Is it all done through your practice management software? Select one of those. We're going to talk a lot about data backup, huge part of HIPAA. In that data backup, how many consecutive days of backups do you have? Do you have one for every day from last week? Do you only keep up one and you just back that one up daily and replace it? Are you not sure? Number 22, does your practice have policies and procedures for restoring an exact copy of PHI in case you deal with a ransomware attack or some other breach? Basically, you're backing up that data. Do you have a written policy and procedure on how you're going to actually restore that data? Yes, no, ask IT. Have you ever tested if you can actually do that? Have you ever had a breach and shut down and practice restoring all that information and getting back to business? Have you ever tested if you can effectively recover? Yes or no? Does your practice have audit controls that can record and examine information activity? Very similar to the question I asked earlier about, do you have the ability to track people on your systems? That one was about, do you have a policy and procedure written down? Audit controls are, do you have a process and system? Number 25, does your practice protect the confidentiality of authorized users and their passwords? And do you have a password policy? So in this binder of the written policies and procedures, your password policy procedure needs to be written. It's got to have 3 capital letters. It's got to be changed every week. It's got to, have a number in it, special character, you name it. Do you have a policy procedure around that? Yes or no? Does your practice implement email encryption to safeguard PHI when it's being emailed? So bottom line, do you have email encryption? Yes or no? Ask IT. Do you have email scanning software that's going to guard you against email phishing or viruses? You have virus protection, email scanning software? Yes or no? Who is responsible for ensuring that all firewalls, antivirus software, data backup systems are all functioning and up to date, right? Who's basically kind of like, who's your IT guy, right? Is it the office manager? Because I've met office managers that wear 19 hats, many of you do. Or do you have a dedicated IT guy? So, or if you're not sure, just click I'd like a system review. So this is kind of written like a Jeopardy question. We do not use mobile devices for email or texting of PHI. So the bottom line is, if you use mobile devices, click false. If you don't use cell phones and like laptops, click true. If you use cell phones and laptops, click false. If you don't, click true. Do you have an inventory of physical systems, devices, and media in your office space? Basically, take my office. I got this big, huge office here in Las Vegas. We probably got about 90 computers in this building. We have an inventory list, computer 1, computer 2, computer 3. I have to have an inventory list to be able to manage if one of those get lost or stolen. It's all PHI. So do you have a physical inventory of, do you have an inventory of your physical systems? 31, do you have policy and procedures for your employees on how they will gain access to your facility and PHI during a disaster? Basically, if I shut my office down because a volcano was busting out, but we needed to get back in my office to provide medical care, do I have a policy that's going to help us do that? Do you have, number 32, does your practice have specific roles and procedures to safeguard computer workstations, including remote access? Just, do we have policy procedures that make sure that are around protecting people from accessing other people's computers? Number 33, do you have a policy procedure that specifies how your practice should dispose of electronic devices and media? So if I said I have 90 computers here and I have personal client information on there, I have to have a whole process for how I throw that away. I can't just go throw it in the dumpster. I got to wipe it and clean it and, go through this song and dance. I have to have a policy procedure that spells that out. Do you have that regarding your devices? Number 34, now we're getting to the kind of the PCI compliance. We're going to talk about that. It's very similar to HIPAA compliance and the way we protect. All of you, majority of you probably take credit cards. So how do you do that? Do you have a physical credit card terminal there? Do you open up some sort of secondary gateway online? Do you have QuickBooks? Do you do it directly? Are you integrated into your practice management software? So select how you take credit cards there. Number 35, have your practice taken a self-assessment questionnaire and attested to your payment card industry compliance in the last 12 months. I'm going to dive into this here in a little bit, but in order to be PCI compliant, you have to do a self-assessment questionnaire. It takes several hours to do. Are you spending a few hours doing your self-assessment questionnaire and then getting your PCI certificate, or attesting to it, I should say? You also have to do vulnerability scans every quarter of your network to be PCI compliant. Are those being done? Every quarter, is your network being vulnerability tested? Yes, no, or maybe you got to ask IT. Number 37, do you have a copy of your PCI certificate? All of you that have credit cards, take credit cards, you should be PCI compliant, have a PCI certificate. Where is it at? Is it on file? Yes, no, ask IT. Number 38 is just saying, hey, would you like a complimentary merchant account review, security, functionality, rates? Look, bottom line is just, if you want this, just let us know. We'll help you identify junk fees on your statement and help you get them removed, and also non-compliance fees. So if you want us to help save you money for free, just by showing you what to get removed from your current system, just click yes. Hard to not want to save money. Number 39, does your practice carry any type of insurance that protects you in case of a ransomware attack, of a HIPAA or PCI fine, loss of business, or any other expense related to data breach? So this is cybersecurity insurance. Do you have cybersecurity and breach liability insurance for your practice? Not your general liability, not your malpractice insurance. You gotta have cybersecurity insurance. Do you have it? Yes, no, or uncertain. Last three questions. Ballpark, how many patient records are you responsible for? 1,000, 5,000. Number 41, how many locations do you see patients or accept patients in? Do you one location? Do you have two? Do you have three or more? This is just going to help us guide you on your program. And last but not least, how long have you been in business? We're going to go 21 or more. All right, all of you. Next thing you're going to do is click submit. It's going to give you a score. It's going to tabulate your score. Give it a second. There's going to be a lot of us submitting this all at the same time. It's going to give you a score. It's not going to give you the full-blown report just yet. My team has that. We're going to be able to email it to you after we walk you through it. So let's get this thing tabulated. So a lot of you, let's let it tabulate. We have 566 people all submitting it at the same time. So it's going to happen. Give it a couple seconds. Just going to give you all a couple seconds to wrap that up. So while that's happening, let me tell you what we're going to do with this. So now you need to review these risk assessments, right? You all have different vulnerabilities and different gaps and different scores that need to be reviewed. We're going to talk about after this this CE is over. We'll take 2 minutes and tell you how all of you are going to get one-on-one help with that for free. We're going to talk about that at the end, and we'll get you a copy of it. So while this is submitting, I'm just going to go ahead and move it to the background so we can keep going. We only got 45 more minutes. Up there it goes. And I want to keep our process moving. So if you're having issues or concerns, I'm sure you guys are all messaging Jacob. He's losing his hair like me, trying to get to help you out. But we'll be in great shape. All right. Let's keep the the CE moving. So again, we're going to provide you a 27-page report. It's going to break down all your deficiencies, question by question, grouping by grouping. We look forward to walking you through that and helping you with that. So let's move into some more CE. So now I mentioned, I think a couple of those last few questions dealt with PCI compliance. So I do want to touch on PCI compliance. So much of it is similar to HIPAA. So first of all, and that, again, that's how you deal with taking credit cards. So Payment card industry, PCI. If you take credit cards, you are responsible for your PCI compliance as well. PCI compliance is similar to HIPAA. Credit card PCI compliance is all about protecting PFI, personal financial information. HIPAA is all about PHI, protected health information. Either way, all of this is still digital, can be breached, you can have financial repercussions. So a lot of the processes and tools we use to protect PHI are the same processes and tools we use to protect credit card information. So that's why I cover it here as well. So one of the things that I think everyone knew about right off the top is, now it's been quite a while, it's been about 5-6 years now, everyone's starting to have the chip in their card, right? Now everyone has to dip the chip minimum. Now we have tap to pay, we have all this great stuff. So I just wanted to put this out here and remind people that everyone knows what a credit card dispute is. I can dispute anything technically. If my card has a chip and I don't dip it or tap it, and I just swipe it when I could have dipped it, that person can dispute that and you lose 100% of the time. The industry created these chips for a reason, and if you don't use it, that's on you, and you'll hold the liability for it. So if you have the chip, dip it. That's my advice. And tap to pay is just as good. So there are these threats to PCI. I love this article. This was an article from a few years back where the FBI actually rated PAX Technology. PAX Technology creates terminals itself, and what it was all about was these criminals had gotten so advanced, they were building their identity theft and stuff software directly into the machines at the actual company. It wasn't even like they were adding it later. So these cyber criminals are never going to stop trying to figure out a way to come take your money. And the first step to your PCI compliance is that vulnerability scan. So basically, think of it as you're on a boat that could very easily spring a leak. And we have to go around that boat and keep poking holes in it and make sure that there's no leaks or holes for water to get into. And that's what PCI vulnerability scanning is like. It's every quarter, so every 3 months, you're going to have a vulnerability scan. It could take 1 to 3 hours, depending on the size of your practice, could be longer. But it's going to be trying to go into every internet port in your office, in your building, they're going to be testing your virus protection, you're testing your firewalls. It's looking for holes. So you have to get these vulnerability scans done every single quarter. Also, in addition to doing the vulnerability scans, you have to do that self-assessment questionnaire, that SAQ. Now that's going to take anywhere from 1 to 5 hours. People who have done this SAQ when it comes to their credit cards, they have to do it every year. They remember it because they hate it. But you have to do this self-assessment questionnaire and attest. I attest that I am PCI compliant. I've done all these things and I've been honest. And then if you do those 2 things, you do your scans every quarter, and you do every year, you do your SAQ, you can, and attest to it, you can now get your PCI certificate, which shows that you are PCI compliant. And on your merchant statements, your credit card statements you get from your provider, on there, many of you are going to find a PCI compliance fee or a PCI non-compliance fee. Those are fees that can be removed if you know to ask and how to do it and what to say. So that was what I was saying earlier about those merchant statements. My team will talk to you about it. I'll help you remove junk fees off that statement, but we want to be PCI compliant. So there's several things so a couple considerations for you to ask yourself when you get back to the office or you get your head back in the office. Again, we're going to send you this PDF so you'll have it. Do you have a PCI certificate on file? Are you doing your SAQs? Are you doing your vulnerability testing? And is all of your equipment in there EMV compliant, like the chip, tap, all that good stuff? Most of you probably have that. And of course, are you paying unnecessary PCI fees? So PCI compliance can be easy and it can be what it's there for, or it can be time consuming and you're throwing away money. We can help you do the former versus the latter. Moving on. Love this. I miss these cartoons. I remember back when the old desks everyone used to have a stack of these on there. I think we may need to update our disaster recovery plan. This one suggests we all run around in circles shouting, "What do we do? What do we do?" That's really what it's like. If you've ever had a ransomware attack, that's probably what you did. You probably went in there and realized it's about to be a bad day. It can happen to you, it can happen to people on a massive level as well. Here's an example. I love this article because it's so to the point. Hundreds of dental offices crippled by ransomware attack. A ransomware attack has crippled estimated 400 dental practices across the US. We have no access to patient charts, schedules, x-rays, or payment ledgers. The doctor cannot do proper treatment without a chart history and x-rays. Man, this is tough. And this I love this example because when these 400 practices themselves didn't deal with the ransomware attack. They were all using the same IT company that dealt with a ransomware attack. So, or their practice management software. If your practice management software goes down, you're kind of screwed. What do you do if the companies you're depending on go down? And that's a business associate. First of all, we're going to talk more about business associates, but your business associates can get breached too. So it's like, what do we do in these situations? And so HIPAA law says you need to have an actual contingency plan. You need to have a data backup plan. You need to have a disaster recovery plan. You need to know what your emergency mode of operations is. So we need to put some of this stuff together. So let's talk about, first of all, data backup and the role that it plays. Your data, again, is very valuable, and also you can't run your business and provide care without that data. So it's not about having a good data backup, right? I can go save my data every single day. It's always about the restoration. Yeah, it's great to have it all on this drive, but I've never tried to plug it in and restore it all. It could take me days trying to figure that out. You always have to do this stuff in advance. So you should be asking yourself, how are you backing up your data? Have you ever tried restoring that data? How many different data sets do you retain? And you really need to ask yourself the hard question, how long are you willing to be inoperable if your systems go down? Is all of that data encrypted, at least to 156-bit encryption level? These are important questions when it comes to your data backup. It can make a bad situation not so bad, or it can make a bad situation a lot worse. So many of you have a lot of different data backup options. We hire third parties. It's being done in the cloud automatically. It's done in our practice management softwares. There's a lot of ways to get this done. We just know your HIPAA program is designed to work alongside your IT company. We don't replace them. They don't replace us. We're a team that all work for you. Okay. Next up is email encryption. Let's keep this simple. Your emails have to be encrypted, period. If you don't encrypt your PHI, you're going to lose it. And email is pretty much one of the most common areas that lead to breaches. So, and it's mainly because employees just haven't been properly trained on the risks of their email, to slow down and make sure you know if you're opening the right emails. And just make sure, we're going to play a little game here. I didn't know what it looks like, these fake emails that are trying to fish for your PHI. I love number 4 here. If you're using a Gmail, a Yahoo, an AOL email still, first of all, I love all of you that have AOL emails. I love the dedication and commitment, but times are changing. AOL isn't around anymore, and you need to change your practices. We are professionals. So get your practice name in your email. But most importantly, the reason being, besides being professional, looking good, is you need a properly secured type of email address. Okay, your free services email, Gmail will say we're compliant. right? They'll say we're compliant. That is not up to the level of compliancy and safeguards that you need as a medical practice. So get rid of it. Let's move on. And then of course you need to have your email encryption. I mean, think of it like when you receive an email and you have to type in some type of passcode or something in order to read it, that's an encrypted email. So it is by law, if you're ever sending PHI via email, it needs to be encrypted. End of story. A lot of simple solutions I have for you to get email encryption if you need it. Let's talk a little bit about HIPAA privacy rules, since we can't like share this information with people. There's kind of this misconception, you know, according to HIPAA release form, I can't share anything with you. That's not true at all. You can share HIPAA information. In fact, the client has the kind of the decision-making power on who gets this information outside of him or her. So there's really this general rule, first of all, and it's that, you know, you have to, as a covered entity, you all are covered entities. The law applies directly to you, so you're called a covered entity. Covered entity must obtain the individual's written authorization for any use of disclosure of protected PHI. It needs to be in writing, and it needs to be in very specific. So you all know all too well, every time you have someone new sit down at your office, you have them fill out some forms. Most of it is probably one of those forms. So let's talk about what we're allowed to do with that PHI and what we're not allowed to do. So first of all, who can we give the PHI to? That private information. Well, obviously to the individual. It's mandatory. I could go back to a doctor that I saw 3 years ago and say, I demand my medical records. They have to, by law, give it to me. So obviously the individual gets the access to that information. Also, the people that are involved in your treatment are allowed to have it, right? A doctor to doctor. I make a referral over to an orthodontist. You know, they're allowed to have that PHI. I have to have the insurance company collect money for your treatment. So they need to get some information about your treatment. So they get access to it in healthcare operations. Now, what a patient can do is a patient can say, I don't want my family to know about this, only tell me. And in that situation, I can do that verbally. It doesn't have to be formalized in writing. I can just say, hey, only talk to me about the money, only talk to me about the care. Then there's always going to be those incidents or those situations, excuse me, it's called incident to. An authorized, you know, for example, we've all probably been in a hospital and walked down a hospital hallway. There's charts and names and PHI all on the wall. I mean, but it's not, I mean, that's natural. That's hard to avoid. So when you're in these situations that it's kind of impossible to avoid any exposure, you really want to use the minimum necessary rule. You know, how I need to give out or share the minimum amount of information in order to get the job done. And the other key of that, of course, is also having a well-trained team that really understands what they can and cannot do with that information. So, and then obviously, again, cannot be reasonably prevented. So a sign-in sheet, right? Your sign-in sheet is a great example. You can put a sign-in sheet that says like first name, who are you here to see, time of your appointment. You can't put what are you here for? You know, what procedure are you here for? What's your last name and phone number? They're not going to tell you to put that in on your sign-in sheet. So those are things you can kind of, you know, get away with. All right, moving on. Let's talk a little bit about the binder and the customization that goes with that when it comes to policies and procedures. So one of those things inside there, we touched on it a bunch, are business associate agreements. So, and I think this is a great time to talk about briefly about the policies and procedures as well, but business associate agreements. So a covered entity must receive satisfactory assurances from its business associates that they are going to protect that PHI. And that assurance must be put into writing, right? I'm not going to take your word for it. So again, I am the covered entity, you are the covered entity. In the course of business, let's go back to the practice management software. I'm sharing all this PHI that I'm being legally held responsible for. I'm giving it to, let's just call it Open Dental, my PMS. I'm giving it to them. I need to know that if they get breached, I need to know that they're doing everything they can to keep that safe, since I can't keep it safe. And so it happens all the time. Here's a great example. I love using people as an example. So here is a story of North Memorial Healthcare fined $1.55 million for not doing their HIPAA business associates and their HIPAA risk assessments. Think about that, you guys. I just had you do a risk assessment in 10, 15 minutes. And obviously we still need to review it to complete that mandate. But these people, this practice, weren't doing that. The simple things like risk assessments, business associate agreements. And HIPAA came in there and audited them. And you know what's crazy about this too? It's not for profit. It's a not-for-profit business. These guys they're not even in it to make money. And HIPAA said, nope, give us $1.5 million. Follow the rules. So what do you think they'll do to you? So let me give you a real life example here of how simple a business associate agreement can be. So real fast, I'm opening up our tool. I am opening up our tool here that we use to navigate compliance for our practices, because I want to show you a real life example of a business associate agreement here real fast. Let me shrink down these things we don't need. Let's go into the binder. So business associate agreements. Let's say that practice got fined 1.5 million bucks. Let me show you just how fast I could have saved that practice $1.5 million bucks. I would have came into my portal, created a business associate agreement, put their basic information in here, and boom, I now have a business associate agreement created for my practice management software. Now I need them to sign it, right? I'm going to go send it to them, send it directly to them. They're going to sign it. And then I have a signed copy on file that they promise to keep my PHI safe. And let's open up one of those and show you what a business associate agreement looks like. It's going to break it down. We're not going to get into all the details. But again, I wanted to point out that one of the most basic parts that are super important that I touched on during the risk assessment, which is the indemnification clause. This little paragraph is going to be the one that financially protects you, doctor, when one of your business associates have a breach. I'm going back to this breach portal. Let's see here about business associate. About 1 out of every 10, here's a whole group of business associates, are business associates. So this is something that's happening all the time. We need to make sure that we're doing our part to protect this data and have an indemnification clause that's also going to financially protect you. Biggest mistake I see here again is your business associate had you sign a form and you didn't have them one that countersigns. Your practice management software had you sign one saying they're protected. You need one that's going to financially protect you. So you need to have both of those exchanged, and you need to have it on file at all times. All right. Moving on. We talked about business associate agreements. So who are some of those business associate agreements? Who are the business associates, excuse me. You know, I talked about practice management systems, legal services, your IT provider, all of you probably using some sort of IT provider. They need to have one signed, your email marketing team, you name it. Some of the things you don't need, obviously, are like your janitors. When FedEx stops by to pick up a package. We have, you know, things like that. Again, other doctors, your employees, no, they're covered under HIPAA, so they don't need a business associate agreement. They're managed other ways, like employee acknowledgements. So business associate agreements are very important. Make sure you get them in place. Also, make sure that they have the indemnification clause, because that'll come back to save your butt. So, polling question number 2 time. Which of the following is not considered a business associate? Is it A, your landlord, B, your IT provider, C, your software provider, and D, all of the above? Go to the polling. Which of the following is not considered a business associate? A, your landlord, B, your IT provider, C, your software provider, or D, all of the above?
All right,
Jacob,
Terry, we'll give everyone about 5 more seconds here. Get those in, get those in. All right, it looks like we had 82% say your landlord and 17% said all the above.
82% of you are killing it. And the other 17%, I know all of the above is usually a safe answer. Got us a C, C's get degrees. But for the purpose of this one, A, it's your landlord. Good job. All right, let's talk real fast about employee training. This slide's a little ugly, I apologize. Hey, 3 things that you need for your training when it comes to employees. A, needs to be modern and relevant. Stop trying to use that HIPAA training materials from 10 years ago. 2, you do it every single year. Do it every single year. It's not good enough if they did it 3 years ago. The world is changing. Threats are evolving. And number 3, everyone who's doing that modern and relevant training every year need to have a signed acknowledgement form that says, I did my training, I understand it, and I understand the policies and procedures. Most of the threats that we're all facing out there are coming from people not being properly trained and not aware that this is going on. The cyber attacks that we're having every single day, every year, it's going up year after year after year. And the reality, here's some of the major stats. 95% of breaches are human error, could have been avoided. 77% of the people on this call do not have an incident response plan in place. And the reality is it takes nearly 6 months sometimes to figure out you've even had a data breach. So I touched a little bit already on ransomware and how it's software that's going to encrypt your file, that's going to lock up your screen. And they're going to make you pay them a ransom in Bitcoin in order to be able to get access to that computer. Here's a great example of what your computer screen could look like. And if you see this, it's the beginning of a really bad day. So we got to protect ourselves. We've got to train our team. One of the threats that get us all the time is called phishing. And no, not the good old phishing that we want to do this summer. Phishing that they do on emails, PH. People send emails or text messages increasingly every day that are designed to look like something else. They're trying to steal your information. So there's a really cool quiz called Phishing Quiz with Google that'll help train you. We don't have time to dive in it right now, but I am going to give you guys a couple quick examples here real fast. So here's an example of an email that was received. I'm going to give you all a couple quick seconds. I want you to look over it. Try to look at what are some of the hints that this is not a good email. So this is from Costco, but yet the email address you see here is cbcbuilding.com. Another tell would be some of the grammar. I'm the worst at grammar, but still I probably know there's a comma after, unfortunately. And then it wants you to follow a link and send back very specific information. And they're trying to scare you by telling you you're going to get paid back less than 21% since your order was booked for Christmas, right? They're just playing into people's fears here at this point. Email kind of looks good on the outside, not so good on the inside once you get into it. Here's another example, PayPal. I've been getting I get text messages all the day, almost every day on my phone that's saying, hey, your Citibank account or your Bank of America account's been disabled. Please click here and log in. And I'm just thinking, man, there's probably way too many vulnerable elderly people and just people that are not hip giving their bank account information away every day. It's crazy. PayPal, what do y'all see here that isn't so good? Same, we got weird email address up here, berkeley.edu. That's weird. Your account has been suspended. Obviously, there's a lot of weird formatting issues. We got some spaces in here in front of the semicolons. So just weird emails like this. This is phishing and get you in trouble. Looks bad on the outside, good on the outside, kind of not so good once you start getting on the inside of it. Last example, Kentucky Fried Chicken and Donuts. Looks so good from the outside, terrible for you on the inside. So let's get our last poll question in. Oh boy, what's going on with the formatting here? We have a poll question. What is true about ransomware? Is it A, The payment of ransom is typically through Bitcoin. B, email phishing is a common gateway. Let's move this a little bit. B, email phishing is a common gateway to network access. C, ransomware can encrypt or lock your data. And D, all of the above. What is true about ransomware?
All right,
What's
Terry.
looking like, Jacob?
The numbers are looking real good. We'll give everyone about 5 more seconds here. All right, 94% said all of the above. So looks like they're paying attention.
I love it. Thank you to the 6% that just like, you know what? I'm a rebel. I'm going against the grain. I love it. Yes, all of the above. All of this is true about ransomware. They will ask you for Bitcoin. Email phishing gets you in that trouble all the time, and they're going to lock up your data. So let's talk about the last one of the most important things, which is really the breach notification rule. We deal with a breach. What do we do next? So the law is very specific. You deal with a breach, you have to deal with very specific, you have to do very specific things. First of all, if I had a breach, I have to have a complete forensic investigation completed. This is a third party that's got to come in, and it's going to cost anywhere from $10,000 to $50,000 to have a forensic investigation, $50,000 plus. They're going to find out which of your data was stolen and what wasn't. Because the data that was stolen, we need to let those clients know via first-class mail that their data was stolen. We put together a little FAQ, we post it on our website, we alert the local media. I think I already give you a great example of all these right here. When I was talking about the school district that had a breach here in Las Vegas. A lot of you have dealt with this, like for example, with T-Mobile. If you're on T-Mobile, you probably recently have received a disclosure letting them know that your information was stolen. So then you have to set up a call center for 90 days, let people know if they call in with questions. You do all of this stuff within 90 days and notify the Department of Health and Human Services just like you were supposed to. And guess what? They're going to reward you for doing such a good job dealing with all these headaches, doing all this stuff, letting all these people know. They're going to reward you with an audit. They're going to show up at your door and say, hand me your HIPAA binder. We're about to find out what else you haven't been doing right. It can be painful. Not only that, but the cost of dealing with that ransomware is separate from the fines, right? You want to run a compliant practice so you can avoid these fines here. We want to avoid these fines. We'll be compliant, but we still face the costs of dealing with the breach itself, which can be very expensive. This is real life numbers from a Dr. Sharma. She had $90,000 in legal fees. Restoring the data, this is that data back I was talking about, and the decryption was almost $40K. She had to hire a forensic investigation team, $55K. And there were 2 rounds the incident response team had to do to negotiate in Bitcoin to get them to unlock the data. This can happen to you guys, and it very well may. And this is why I was saying you have to have cybersecurity insurance these days. Is your practice financially protected? You protect yourself in every way. You have life insurance, you have car insurance, health insurance, malpractice insurance, general liability insurance. Those are required. This is optional, yet this is the one that the numbers show. You are going to need your cybersecurity insurance more likely than any of those other types. And a good policy is what gives you peace of mind at the end of the day, that know that I've trained my team and we're doing everything we can to have a culture of compliance. And if something still goes wrong, I have insurance that has my back. Okay, that insurance should protect you against HIPAA audits and fines. So you have a new employee that comes in there, opens up an email dealing with a data breach. Now you're dealing with a ransomware attack. We'll pay the ransom. We'll notify the patients on all the breach notification rules. Maybe a PCI breach as well. You're going to have to restore your data. That's data backup costs. And of course, you're going to be down for a while, losing business and losing money due to this. So a good policy is going to protect you. And I know my team can show you how to get that done the right way, the cheapest way. But for now, just know you need to have a cyber insurance policy in place. Moving on, as we got 15 minutes left, a couple more things to touch on. A couple false misconceptions I don't want you dealing with. One, my IT firm handles my HIPAA compliance. Biggest misconception I see happen all the time. Your IT company is here to help assist with some of the technical safeguards of HIPAA. They are not going to customize your binder. They're not going to train your team. They're not going to deal with a breach, and they're definitely not going to pay the fines from an audit. So we are here to work alongside. You are here to work with an IT company in your compliance. They're not working against each other. 2, my practice management software is HIPAA compliant, therefore I'm HIPAA compliant. Unfortunately, I'm sure your software is HIPAA compliant, but that has nothing to do with anything. You still have to run a culture of compliance, know how to use it, know how to lock that computer up so people can access that software, and you still need to have a business associate agreement in place with that practice management software as well. My general liability policy will protect me. That general liability policy that you pay for, that you're forced to pay for, will not help you with anything that I've talked about here today. You need to have that cybersecurity insurance. Lastly, my office manager is on top of it for me. Are they? How were they trained? How often were they trained to do this for you? What tools and resources did you give them to do a good job? Your office manager and most dedicated professionals, anyone in the healthcare space, I would say, I know are dedicated to doing a good job. Give your team the tools to be on top of it for you. And I have some free gifts to help with that I'll cover at the end of this call. I'm going to touch on OSHA here real fast. I just want to let you guys know, the pandemic is over-ish. We're still dealing with heavy COVID, right? And COVID issues and all types of things. I'm not even going to get into it. But the point being is OSHA is still out there finding people for not doing a good job when it comes to OSHA. So they're out there finding people left and right still for not handling their OSHA the right way, doing all the right things. So you're probably wondering, what are my OSHA training requirements? Say there's 4 specific areas everyone has to be trained in. And I'm mainly going to talk about number 1, COVID-19 preparedness response training is still a requirement under law. Everyone has to go through that. There's also a respiratory protection standard that applies to everybody. Okay, California just has more on top of everyone else. So you have to deal with the respiratory protection standard. Some of this stuff may sound like we're talking Greek, but I can tell you, we are exiting with the pandemic the greatest occupational hazard in our working lifetimes. So it's been a really big deal. And one of the free resources I'm going to provide you at the end of this is an OSHA readiness checklist. So you can kind of go through the checklist and kind of get a good idea where you're at with your OSHA. And then if you need some help, you can reach out to us. But we're going to cover the resources we have to help you with OSHA here at the end of this call. So with that being said, let's wrap this up. Let me give you my 20 tips to protecting your practice. Number 1, update your HIPAA OSHA plans, policies, and procedures. I appreciate all of you so much coming here today and listening to me talk about this. It's not fun, it's not interesting, but please do something with this information. Don't just go back and collect your CE. Talk to your boss, talk to your office manager, talk to your doctor about any of these gaps that I may have talked about today that you may see you're dealing with at your practice. You are doing them a favor by saying, I see a gap that can cost you a lot of money. I just want to point it out to you. So update these things. It's for your own good. Document how PHI is accessed and secured during an emergency. I told you that 77% of practices do not have an emergency response plan. It is so key. Let me give you a quick example here. Part of your portal or your binder, whatever, you got to have an incident response plan. In our portal, for example, we have you have to define who is your incident response team that's going to jump into action. Who's backing up your data? When's the last time you tested restoring it? Who's in charge of the emergency mode of operations? Who's your IT company? All these things have to be documented. And then once you do that, you put it all together and it creates this emergency plan, right? Who's on my incident response team? What's their phone numbers? You need to have this all together, right? So really important that you have this emergency plan put together. It's probably one of the hardest things to put together. I have a whole team of people here that can help you with it, but get one in place. I touched on business associate agreements. They're one of the easiest things to get done, and they can save you the most amount of money. The key is making sure you have them for all of your business associate agreements. So We can help you go through and to figure out who needs one, who doesn't. Again, the PDF will show you some of that as well. And make sure, of course, that business associate agreement has that indemnification clause. Of course, as we make these changes, as you go back home or go back to your practice and you implement some of this, I'm glad you did, but make sure you're documenting what you changed and what you've done. The government wants to know, they want to see where you're at and what you've done to get to where you are. So everything must be documented. I'm going to say it one last time. Your HIPAA binder is a guide of two things: of everything I have already done to be compliant, every training, every scan, everything, or the way I will handle everything I will deal with in the future. And that's what policies and procedures are. When I need to go do something regarding my compliance tomorrow, I have a step-by-step guide on how to do it here in my binder. I gotta have that documented. Obviously, don't share any patient information without authorization. If in doubt, don't, okay? Ask questions, make sure you're giving it to the right person, because a lot of this, again, I told you, human error is the cause of most breaches, and so is you kind of take off the wrong person in that practice. They see you doing something wrong or giving their information out. They're gonna call HHS and complain, and now you're dealing with an audit. That's how most OSHA audits and fines are administered, is because someone just called and complained. So don't share any patient information. Train your employees on the dangers of downloads and opening emails. Oh my goodness, it can happen to anybody. Please train them. This one I love all the time, we see it. Never wire money from an email request. Make it a verbal confirmation. I run this whole office here and we still get spam emails, and we have all this great software and everything, but it still happens where there's an email that comes in, hey, this is Dominic, the CEO, Terry. I need you to run down and send a cashier's check for me. You know, it's little things like that. And when somebody in your office, let's call it a front desk person, not the highest on the totem pole, but they want to do a good job. If they get an email from their boss saying, go do me a favor, they want to do a good job. They're, oh, the boss is asking me to do something. Well, make sure you get a verbal confirmation on that. That's all I can say there. Happens all the time. Be careful and aware with new employees and their access to PHI. I'm a lover. I care about people. I look at people. I assume the best. But unfortunately, reality in our world is everyone isn't a good person. And until we really get a chance to get to know them, we have to make sure we're being very careful with what we share. Don't share patient photos or info on your website or social media without patient consent. True story. I'm from Texas. Had a family member working at a hospital in Austin, Texas. There's a famous college football team out there called the University of Texas Longhorns. They had a famous Hall of Fame running back called Earl Campbell, and he was at that hospital receiving cancer treatment. And this person put a video up, or a picture saying, "Get well, Earl Campbell," on their personal Facebook. That's a HIPAA breach. That guy is in there fighting for his life. It's not for everyone else to know. So no photos, no information on social media. Change your passwords. No more home row passwords, right? No more 123. I love KFC fried chicken sandwiches with donuts. You know, get rid of those easy passwords, make them more difficult. Always use screen locking on your laptops and your cell phones. Always make it a password or PIN protected. It's just common sense. Always, when you do that, set up that ability where if somebody gets the password wrong too many times, it's going to erase all the data. Get that done. Make sure you've updated all your firewalls and antivirus system. Ask your IT guy, when's the last time you did that? When you're backing up your data, I need you to make sure it's at least 256-bit encryption, and you should be doing multiple days, multiple backups. Okay, I recommend a cloud-based solution that's doing it in the background multiple times a day, so you have multiple sets out there to protect yourself. Plan for an emergency and expect an emergency. Be ready for when it happens. Be proactive in getting prepared so that we're not reactive, scrambling, running around, running in circles saying, what do we do? What do we do? Plan for it. No more public Wi-Fi. Make sure you're getting on a VPN. If you don't believe me, Google the word crack after we're done. and you'll see that people can steal your information all day, every day, sitting there at Starbucks Wi-Fi. Don't store any patient information on a laptop. It's just way too risky, gets people in trouble all the time. Get rid of that AOL email for a business purpose. If you're personally using it, keep using it. I love it. But for business, no more Gmail, no more AOL, no more Yahoo. Go get cyber insurance, or if you already think you have insurance, time to review it and make sure it's proper to cover you against modern threats. Make sure you have your PCI certificate on file. Always do your HIPAA risk assessments, which we did today. We're going to talk about that here in a second, and get your network scans done, of course, your vulnerability scans. And then that's it. This you see here, you kind of see this whole range of things. All of this is required for a culture of compliance. HIPAA, PCI, OSHA, cybersecurity, have your licensure. I can help you with any and all of this, and we have a lot of great resources that we're going to start sharing with you right now to be able to get that done. Jacob, you want to talk a little bit about our resources that we put together? And I'll say, so all of you, if you go to PCIHIPAA.com, go to Explore at the top, and there's the tab Compliance Resources. On there, you're going to have a link to HIPAA risk assessment. You don't need that. I'm going to get that done. Importantly, though, all of you have gotten the risk assessment done. I need you to go there and book your risk assessment review. I have compliance professionals that are going to walk you through it, give you a one-on-one walkthrough of your risk assessment, and help you understand your gaps so you can go fix them. I don't mind giving my team time of their day to do that. That is why we're the leaders, because we're the leader in education first. That's how we become the leaders in compliance. So let us educate you for free. Also on there, I talked about making sure your office manager, your compliance officers have the tools to do a great job for you, doctor. And for those of you who also want 2 more CE, I have the country's best certified HIPAA officer training course. It's a 2 CE credit course. And if you don't need CE, fine. It will teach you everything you need to know about what it means to be the compliance officer for the practice and what your responsibilities are. These are our gifts to you. Jacob, did I miss anything?
No, you pretty much covered everything. Just as Terry mentioned, just put a bunch of links in the chat to the landing page, link if you want more information on what we do, and also put a link to the survey. It'll also pop up at the end, but please click on that link now and make sure you open it up in a tab so that you can fill out that survey so we can hear from you. And also we will be picking 3 winners for an Amazon gift card on that. So those are my last few things there. So appreciate everyone joining us.
Yes, thank you all so much. This concludes the CE. So the CE is over. Now let me tell you about the free stuff I got for you to really help you all out. Okay, first of all, I already told you about the risk assessment review. One thing I can tell you right now is my team will not get on that risk assessment review and try to sell you. I promise you we will educate you. We know that if we do a good job educating you, you can make a knowledge-based decision on whether you want to work with us, not a trust-based decision. So if you need the help, you'll be able to see it for yourself and be able to then make a decision to say, hey, Terry, let me see a little bit about what you guys have. Now that you even know what you need, you can appreciate what we've put together even better. Let me fix this formatting here. Also, so if you end up working with us for any reason at all, or at any capacity, just know, if you attended this webinar and you end up utilizing us for compliance or any of our integrated payment solutions that work with any payment practice management software you have, by the way, I'll give you a free month. If you end up working with both our solutions, once you see them, there's nothing like what we have when it comes to Office Safe or our Practice Management Bridge. Our Practice Management Bridge is integrated payments. So no matter what practice management software you use, you can do payments directly into patient files, card on file, text to pay, you name it. We'll put a payment button on your website. It doesn't matter. But either way, it's all free. And if you use both of those, we'll give you 60 days free. And most importantly, I'm not asking you for any money up front. I'll get you compliant. I'll implement our whole system. I'll help you collect money. I'll do all of this, and you won't have to pay us any money for months. So I would say start with the free help. Book your HIPAA risk assessment review. Jacob, if you wouldn't mind, if you haven't already, I want to put that link to booking the risk assessment review directly in the chat box. Book your risk assessment review, get educated, and then let's talk about working together. But right now, let's get educated. So again, everyone out there across America, thank you so much for all your time today. My name is Terry McDonald, representing Rectangle Health and PCI HIPAA. Jacob Borkover, the man on the webinar team. We hope you've really enjoyed everything today, and we look forward to working with you more in the future. Just have a great day, everybody.
Thanks, everyone. Thanks, Terry.
Thank you.